I'm struggling to try to survive out here. I've had jobs, I've tried different programs, and always come to the bottom line, nothing.
In a country where 1% of the population controls more than 90% of the wealth, people are getting desperate.
I'm like jumping from house to house. With my income, I can't afford nothing by myself.
More than half of Americans struggle with medical bills.
There have been efforts to bring down healthcare costs in the U.S. It is proven difficult because of the power of some of the pharmaceutical companies.
And when you're struck down, it's hard to find a way back up.
And nobody should just get handouts. Like, you should work, but they make it so hard.
This is an emergency. We don't have nothing but what people gave us.
It is the land of opportunity, but for those who don't make it, a difficult road can lie ahead. America might be the richest country in the world, but it also has the largest pay gap. The rich are getting richer, and the pandemic has only made the situation worse. Recent research shows that 75% of Americans are concerned about the economy, and nearly 80% fear that the rising cost of living will make everyday needs like housing unobtainable. I'm in rural Virginia, about an hour from Washington, D.C. I've come to meet a family who has first-hand experience of what happens when things go wrong here in America. Meet Dasani Melendez, her partner David Lawson, and their twin daughters.
They were both born at the same time. Everybody's like, who's older? But they were both. I had a C-section. They were both born in the same minute.
The family was living in a large house with Dasani's grandparents. Dasani and David are full-time students. They had plenty of support and felt like life was going well, but Dasani's grandfather died suddenly, and hours later, further tragedy struck the family.
It was like probably 3 hours after we got into bed. We just fell asleep, but like it was not even 15 minutes, my eyes were closed. And then that's when we heard grandmother screaming upstairs, like, it's a fire, it's a fire.
And I just ran down I ran and fell down the stairs with the babies. I had both of them in my hands. I didn't get to grab a jacket, or I didn't even get to grab them a jacket or anything.
I can obviously clearly see that the shock's still there.
Yeah.
Definitely.
The family home was completely burnt down. Overnight, everything was gone.
Life was just getting started for us when we lived here. We just met each other, and we moved in here together, and it was fun. We had our babies here. I had my pregnancy here.
This was our spot.
It was our home to get our life started.
They received help from the Red Cross to buy urgent supplies for the babies. Other than the small donation, they are on their own. They are staying with Dasani's father, but it is not a long-term solution.
It's very snug.
There's already no room for us.
Yeah, it's really tight. It is very difficult to get EBTs, food stamps, and apply for them, and it's very difficult. It's a super long process to do, and to even get it in your hand is a weight within itself. It's like when you need food, you need food.
After losing the family home in the fire, Dasani's grandmother Jacqueline is now homeless.
We really is a close family, you know. But my husband was, financial person. He brought most of the money. But I'm gonna miss him. He made sure the rent was paid, food was in the house. I don't get paid that much from the county, but I'm like jumping from house to house, you know. And we've been trying to find places, but with my income, I can't afford nothing by myself. It's nothing available. We went to Red Cross. They can't help us. They did give us some money, you know, to stay in the hotel, wherever food, wherever clothes.
Jacqueline has spent more than 20 years working in the public school sector and drove cars for Uber and Lyft to supplement her income. At the age of 64, she is left with nothing, and there is little help available to her from the state.
I feel that the government should help us. You know, this is an emergency, you know. We don't have nothing but what people gave us, you know, and we can't afford the housing around here now.
The family had to choose the most basic funeral for her husband. They simply couldn't afford much. Jacqueline also has some healthcare issues, including diabetes, but says that she cannot afford the treatment.
So I went to the emergency about 3 weeks ago. That bill was like $500. I paid for medical through the school system, but I still have to pay a co-pay, and you still have to pay another pay. You know, it doesn't stop right there, you know, and it's sad. We're supposed to be United States citizens, you know, and, you know, I don't know what to do.
Recent findings show that half of all US adults say they have put off or skipped healthcare in the past year because of the cost.
There are millions of people across the country who are saddled with healthcare debts. Why is that?
It is because healthcare cost is so high. Actually, the number one cause of bankruptcy in the United States is medical debt. That's the leading reason why people have to declare bankruptcy, is because they have medical costs that are too high. Now, part of the reason for this is because if you have a problem, if you need to go to the hospital and you don't have insurance, or even if you have insurance but you have, let's say, a very high deductible for your health insurance plan, then that may cost thousands of dollars for that care.
More than 37 million people in America are living below the federal poverty line. The figure has increased since the start of the pandemic.
The United States pays very high prices for medications. So the same pill of medicine that I might buy in the United States might cost 1/5 that price in Turkey. So the same pill, same medicine, might have both been manufactured in the same place. Maybe they're both manufactured in Switzerland, or maybe manufactured in Turkey, or maybe manufactured in the US. But healthcare prices differ because of the policies in the countries and the way we regulate it. For many years, there have been efforts to bring down healthcare costs in the US. It is proven difficult because of the power of some of the pharmaceutical companies.
Today I'm meeting Reese. He's from Washington, D.C., but circumstances left him homeless.
Well, my story began quite a few years ago. I was a young guy out here in the street doing the things that we do in the streets, and it took a turn. I went to jail, and this and that. Came home, did the same thing over and over. Now I'm to the point, the last person in my family passed, and I'm struggling to try to survive out here at the moment, you know. I've had jobs, I've tried different programs and things of that nature, and always come to the bottom line, nothing.
More than 5.5 million people experience homelessness on a given night in America, and getting back on your feet is no easy task.
Constantly hoping and praying that something would happen for me that would make my life that much better.
Nearly half of all Americans hold low-paying jobs. Income inequality in the US is the highest among all the G7 countries.
So it's an income problem because we don't pay a wage in this country that allows you to access housing. So if you look at what America considers the minimum wage, which is in most cases, that's the most a person can earn based on their education or their ability. So if you make that minimum wage, there's not anywhere in the entire United States where you can afford a 2-bedroom housing unit. So that eliminates any family that's homeless. And only 10% of the country could you afford a 1-bedroom housing unit if you make minimum wage.
The state of Virginia, for example, is $9.50 per hour. That's a monthly salary of $1,500 before tax. But the cost of an average monthly mortgage in the state is at least $1,200.
There's quite a disparity. 1% of the population in the United States control 90% of the wealth. And for those at the very bottom of the economic ladder, it's a horrific situation, if you will.
Back in Fredericksburg, and Dasani and David have some tough decisions to make.
We just buy what they need first, and if we can't, then we don't buy. We would buy food, but we would also buy, like if they needed diapers or anything like that, we would buy what we needed at the time. We were just like, okay, gotta pick wisely. Especially now with what has happened, it's just like I did have to think, do I buy shampoo or do I buy them some clothes? Or do I buy myself this jacket or do I buy them clothes?
A neighbor gave Dasani a jacket. Everything they now own has been donated by the local community.
I saw that somebody donated like feminine products for the monthly, and I wasn't even thinking about that. I was like, wow, I'm just so grateful, and like with the fact that the community helped us out and bought things to us, we're just so grateful.
The gap between black and white households has been rising steadily since 1970.
We're Black, African American, living in America, and even that in itself is a whole nother story that I feel very passionate about. And to be living in this country as an African American woman is not easy. And I'm not a man, but I know that it's even harder for men. And I think that it's portrayed as this country that, does everything for their people, but they really don't. They just don't. And nobody should just get handouts. Like you should work, you should do what you have to do in life. But I think that they make it so hard for you to even try to make a living for yourself, for you to even try to get somewhere.
Half of all US households struggle to make ends meet, but an income must fall below a certain level to receive help. And it is based on figures that haven't been adjusted to reflect the rising cost of living. Financial distress is shaping the lives of millions. People are increasingly relying on loans, and on an already insufficient budget, this creates a nationwide crisis that can drive low-paid workers deeper into debt.
It's like when you feel like you're getting somewhere, it feels like if any small thing happens, you're going right back down. Because in America, I think that it's not, there's opportunities, but they're hard to get by.
There is a constant debate over what the state can and should provide, but the simple fact is that the costs of basic, everyday needs are going up, and many are feeling left behind.